Our next part of the Sports Medicine 1 refresher is going to cover some muscles and bones. Now, in my Sports Medicine 1 class, we kind of broke this up in a couple different ways. Kind of first learning the different types of each vessel, of the vessels and the bones, and then we went into the body part specifically. So hopefully some of this will be a refresher from Sports Medicine 1. So as far as the bones, okay, if you remember, we start with around 270 bones when we are born, and then as you age and go through to full maturity, that number turns into about 206. Those bones fuse together, okay, where they end up being one bone as opposed to maybe what could have been 2 or 3 bones put together. And so at full maturity, our rate is 206. There are 5 different types of bones that we discussed in Sports Medicine 1: long, flat, short, irregular, and sesamoid. The long bones we see in our arms and our legs. They are like our femur and our humerus, the tibia, the fibula. They are good for movement, long levers. Okay, usually the muscles that attach there work with the bones, and they are strong bones. They're harder to fracture. Another big important factor about the long bones is the fact that our new blood is made inside of the long bones, and that is something that is unique compared to our other types of bones. The next one that we have is flat. Okay, flat bones are good for muscle attachment. They leave a lot of area where the muscles can connect, which help to produce movement as well as to protect the bones. The muscles laying on top of them will decrease the chance of a fracture. Examples that we see: the scapula and the bones that make up our skull. Okay, they are more flat surface. They don't have all these protrusions on them that we see, like the femoral head and the greater trochanter and that kind of stuff. Next type that we see is the short bones. We see like the carpals and the tarsals in our hands and in our feet. They glide on top of one another. They do have movement, but not as much movement as compared to our long bones, like in our elbow. Our elbow has a bigger range of motion than our fingers do. Irregular is our vertebrae. We have other different parts of our body that we see these as well, but they're kind of just their own unique shape. They don't really fit into the other categories. There's usually lots of little bony projections that stick off on top of them. Our last one is sesamoid, what we call our floating bones. They are found in our kneecap, the patella, also underneath the hallux. They work in cooperation with tendons to help with flexion and extension, to help with movement. Okay, so those are our 5 types of bones that we discussed in Sports Medicine 1. As far as the muscles go, okay, all muscle fibers are broken down into 3 categories. They are either smooth, cardiac, or skeletal. Now, as it relates to sports medicine, most of the ones that we concern ourselves with are the skeletal muscles, but we need to know about all the other ones as well. So the first one that we have, smooth muscles. Smooth muscles are found in the internal organs, like our stomach. They help to digest our food. They are what we call an involuntary contractor. They do it on their own. I don't have to tell my stomach, please contract. I need you to chew up my food. It already does it automatically. We also have the cardiac muscle fibers, that are the muscles that make up our heart. Again, they are an involuntary contractor as well, because I don't sit there and tell my heart to beat, 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 beat. It does it without me having to do anything. The last type is skeletal muscles, okay? And these are the muscles that we use for movement. There are several different types of skeletal muscle fibers. Let me adjust here and adjust some more. Okay, Here are the ones that we discussed in Sports Medicine 1. We have the parallel muscle fibers, which are right down here, and that is where the muscle fibers are one on top of each other, just making that parallel pattern. They do produce a good amount of movement, but not as much as compared to a couple of our other ones. The next one we see is fusiform. That would be the example there would be like our biceps right here. The fusiform is a very good, strong muscle. That's one of the things that the fusiform muscles are known for. We have circular, which is like around our mouth, that the muscle fibers can open and close, open and close. We see convergent, like in our pectoralis, where it fans out. We start on the same spot and it fans. And then the last is our pinnate groups, okay? Bipinnate, unipinnate, and multipinnate. And they vary all over our bodies. And the examples that we see here consist of the bipinnate being one of our quadriceps muscles, the unipinnate being one of the muscles in our forearm, and the multipinnate being our deltoid muscle. So those are going to have a lot of variations to them. The very last part of this section of the Sports Medicine 1 refresher is about inflammation and our injury process. So all this stuff so far has been from the first chapters in Sports Medicine 1, Unit 1. So signs of inflammation. This is one of my favorite pictures. If you can see, signs of inflammation. There's redness, edema or swelling, ecchymosis, which is the discoloration, increase in body temperature, which is heat shown here, and warmth to touch, okay? We also see on here that there's pain and loss of function. Now, all that's going to be all included in the inflammatory process, as well as if you have any type of re-injury and this happens all over again. So our phases of healing. Remember, this doesn't matter if we're dealing with a soft tissue structure like a muscle or a tendon, or if we're dealing with a bone. It's still the same 3 phases of healing. It just has a little bit of changes depending on what we're dealing with. So in the first phase, that acute inflammatory phase, I lost my slides. Hold on. Okay, now we're back. The acute inflammatory process is the very first phase of healing. And in this process, we have the blood that rushes to the area, and in that blood, it brings the several different tissues and several different cells that are in there going to help with the healing process, like our phagocytes, which eat up the damaged tissue. Okay, it also brings new oxygen to the cells that could be dying because of the increase in swelling. And so this is kind of where all these signs of inflammation are first noticed: the pain, the redness, the swelling, that kind of stuff. This is usually going to last for the first 3 days or so, depending on how bad it is. It's one of those things that if I have a paper cut, it's not going to be in that inflammatory process as long as it would be if I had a broken bone. Phase 2 is referring to the repair phase, and that is where we described it as the quick fix band-aid that's kind of thrown on as a quick, let's stop, let's try to heal this, and then we'll make it look nice and pretty at a later time. So in the repair phase, we see it lasts anywhere from 3 days to 3 to 4 weeks, depending on the severity. And during this phase, this is when we see that quick fix. So we start to see the collagen fibers start to just quickly lay over and try to patch up our wound. We first see the appearance of osteoblast, osteoclast, fibroblast, and fibroclast. Remember, anytime you see osteo, it's referring to a bone. Okay, there's injury to bone tissue. When we see fibro, that means it's dealing with a soft tissue like a muscle, a tendon, ligament, cartilage, or skin. Blasts are used to build up, and clasts are used to eat away. So we first see those cells brought in, and they start putting the patchwork together, basically. And the last phase of healing is the remodeling phase. We're finally healing. Okay, those of you that have had scars, this is where the scar becomes less noticeable, and over time, eventually you're hardly able to see it at all. So this is anywhere from 3 to 4 weeks to a year, depending again. I'm not going to have to deal with a paper cut for a year. And this is where those fibers that were quickly thrown together, they start breaking apart and are replaced by nice, smooth muscle collagen fibers that help to kind of give you more of a permanent fix instead of it being just a quick, let me try to prevent myself from getting more injured like in stage 2. Stage 3 is making it nice and new and perfect. So those were our 3 phases of healing, and there's a couple things that are going to make us heal faster or slower. The first couple things that we see: medication. If you're on a certain medication, it could delay the process of the blood getting to that area potentially. Age, somebody who is older is going to heal slower. How bad it is going to lengthen your time. If your body is dealing with some kind of sickness or illness, your body does its best to try to work on more than one thing at a time. But if I have, let's say, the flu or some type of virus, my body is also trying to send cells to fight that bacteria that it doesn't have the resources to necessarily get as much to my injured ankle as it should. If you return to play too soon and you are using that body part before it's ready for it, you kind of end up re-injuring it. What you eat is going to play a role. If there's not good blood circulation to the area, think of somebody with poor circulation. If they have an injury to their hands or their feet, and blood's not getting to that area like it should, then you end up having this area heal slower. And the consumption of drugs and alcohol are also going to play a role. That is this section of Sports Medicine 1 refresher. The next time we'll talk, we're going to talk first aid.